I worked in nursing homes. I was the medical director of many nursing homes while working with the last company I worked with. And one thing I saw consistently that really just disappointed me in medicine and even humanity in general was that people with wounds would be treated month after month after month. And they'd treat them with something for a month, and then they'd change for this, and they kept changing the treatments, but the people never got better. And then I started noticing that there may have been some disparities in the classification of the wounds. And then people started telling me, well, yeah, if they don't classify them as that, if they don't do this, if they didn't go in and do something painful to the patient and cut them and debride them, they couldn't charge. And I thought that was wrong. It just bothered me. At the same time, my best friend in the whole world got wounds that I couldn't heal. I hired nurses to come over to him, and we tried to heal him, and it wouldn't work. And I was approached by some people that sold membranous amniotic grafts, and we talked about those, and we also started with a product that is still going through FDA approval now that I did the case studies on, called My Own Skin. And we put My Own Skin on him, and it was the first time it had been ever used in the lab. So I was the first one to use it, and I used it in about 5 patients. And it was amazing. In fact, I was very skeptical, but we put it on, we left it on for 3 weeks. And when we took it off, he was healed. He had skin over that area, he had no pain, and it was amazing. And then shortly after that, he broke out with a couple others, and the people that introduced these products to me actually introduced the amniotic grafts to me. And they said, why don't you try these? And I was skeptical again. This little piece of just kind of tissue paper, it looked like, placing it over the wound, and they said it was going to heal it. And I asked other men that were using these grafts. Not a lot of people had used them here in Colorado, and there wasn't a lot of anything but anecdotal. There was good evidence through the FDA and through the CDC, but people didn't know the long-term use of them. My Own Skin, it was touted as being an autograft. In other words, it was taking part of their tissue, their blood, putting stem cells in the product, and that's cord blood stem cells, not but cord blood stem cells. And then they give you a piece of skin, looks like a gauze piece of skin. You lay it on the wound, and the hardest part for people is that you cover it with a piece of silicone and another dressing, and you leave it for 3 weeks. And you can never go past that silicone, and that silicone never comes off. You can change the other parts of it, but the silicone stays right where it is. And we used that. The first woman I used it on, it was amazing. I told her, I said, in fact, I was very honest with her. I said, no, I've never used this before. Nobody's ever used this before. But I said, I think it's going to work. I said, from everything I know, it's going to work. And she told me that she felt she was going to die with her wound. She was a quadriplegic whose her wheelchair, the screws in her wheelchair broke and come through, and she sat on those screws for about a week without knowing it because she has no feeling. So she had 2 holes. They were 8.5 centimeters from the outside. They went all the way up into her ischial bones, which are bones that basically you sit on. And her ischial bones got infected, and she had multiple surgeries. She had washouts. She had bone scraping. She had antibiotics. She really felt like she was going to die with these wounds, and she's completely healed up now. I was amazed. I myself had to learn, and it was cool because as I did the applications, I started seeing how the wounds looked as they healed. And knowing that allowed the next one I did to be even more successful, because I'd say, oh, that's normal, that's what to expect, that's what to do. Because I did Jackie, the first woman. The second woman I did was the woman you met before, Maxine. And when I did Maxine, I already had a really good knowledge of what it's going to look like and what it was going to do. And it turned out well. She took a little bit of a turn, but when we got her back, we healed her up. And I can still remember the day and I had told her before, but she forgot. But she said, "Can I take a shower now?" And I said, "Maxine, you could have taken a shower a month ago." I said, "You can take that thing off your leg when you take your shower." I mean, if anything fulfilled me as a doctor, I could have, that day, if somebody had said, "You can't be a doctor anymore," I'd say, "It's okay." I have really, really reached the pinnacle, of really affecting somebody's life. So my focus with compassionate concierge physicians has always been to improve the lives of the patients and improve the lives of the nurses. And I also have seen my nurses go into patients' homes, and the relationships they have with them are just incredible. Relationships where patients will tell them things they won't tell me. Not because they don't trust me, but because they don't want to burden me. But the nurses, they bare their hearts to, and the nurses love it. This company is dedicated to not only making your life better, but the lives of the people in it better.